I'm Dr. Thomas Molinaro. I'm a reproductive endocrinologist. I'm also the lead physician in the Eatontown office of RMA of New Jersey. I actually grew up in the Maryland suburbs just outside Washington, D.C. I am a Washington Redskin fan by birth, and I was fortunate enough to be a youngster when the Redskins won Super Bowls. So, of course, that helps solidify your loyalty. I also grew up at a time when Washington, D.C. did not have a baseball team. So my baseball team, since I was a youngster, was the Baltimore Orioles. And I've suffered through many years of mediocre baseball until recently. The Orioles have sort of had a resurgence this year, so I'm more than happy to see them back in the thick of things. Well, it's sort of cliche to say golf, but it is true. I do enjoy playing golf. I think that when you graduate medical school, you should get your diploma and a set of golf clubs, right? So it is really hard to find time, but it's definitely something that I enjoy. I did my undergraduate work at Loyola College in Baltimore. I did a master's degree at Georgetown University, and I completed my medical education at New Jersey Medical School in Newark, New Jersey. I trained for both my residency in Obstetrics and Gynecology and my fellowship in Reproductive Endocrinology and Infertility at the University of Pennsylvania in Philadelphia. And during my fellowship, I also completed a Master's of Science degree in Clinical Epidemiology, which I find quite helpful when it comes to reading the latest literature and identifying sort of problem areas in our field. When I was 15 years old, I was in a pretty serious car accident and I fractured my femur. So there was an orthopedic surgeon who took care of me at the time, who performed surgery to repair my broken leg, and who just had a very calming, very relaxed bedside manner. And he really made me feel comfortable that he was doing the right thing to take care of me and sort of help me heal both emotionally and physically. And so I think that was probably the first time where I thought that I might want to enter the field of medicine. I think that it's really important when I meet a couple to come up with a clear game plan, a clear path to pregnancy, with the idea that we'll have a treatment plan for now and a treatment plan for down the road if our initial plan doesn't work out. So I like to set the table from the very beginning, and part of that is setting expectations, and part of it is also making sure that the patients understand that this is a process and that we're going to work together as a team to try to figure out what's the right treatment plan for them. Every couple's different in many ways, not just medically in terms of their particular situation, but also emotionally and sort of in their approach to fertility treatment. And it's really important to me that we give them the best treatment, not just medically, but also emotionally in terms of supporting them in all of the very important decisions they have to make. I think it's really important for couples who are still trying on their own and haven't been successful to take the first step, to make an appointment. Infertility treatment is more than just in vitro fertilization. There's a lot of treatments that happen beforehand. There's a lot of diagnostic evaluation which can be performed. The hardest step is taking the first step. And I would really encourage patients to make that initial appointment, to have an evaluation done, because there's nothing worse than meeting a couple who've been trying for years and years, only to find out that if they had come sooner, we could have been more successful. So taking the first step is really very important. RMA is a unique place where there is an incredible history of clinical excellence. The program has been among the leaders in assisted reproduction for so long. There's so much experience here, but there's also a desire to improve. So the way we practice infertility treatments today is different from the way we practiced 2 years ago, and it's hopefully different from how we'll be practicing 2 years from now. We constantly believe in reassessing and reevaluating how we're doing things, because we firmly believe that we can always be better. Until we have 100% pregnancy rates, there's always work to be done. Most days I start at the office early, 6 a.m. with morning monitoring, ultrasound scans, and early procedures. And then I'll spend the majority of the day seeing new patient consultations and return patients, sort of reviewing their treatment so far. And then at the end of the day, I usually spend quite a bit of time returning phone calls. I think the single biggest thing that patients come in looking for is hope. They really want hope that this is going to work, that they're going to conceive. And when you work in a place like RMA, you sort of have the privilege of telling them that for most patients, there's a pretty good chance that they're going to get pregnant. So being able to give them that hope, whether it's a couple that's just starting out on their infertility journey or whether it's a couple who has failed IVF at other centers, when they come to a place like RMA with the cutting edge technology and the forward thinking of both the clinicians and the laboratory staff, it really, really is important to us that patients see hope.